So we're still talking about synovial joints. Right here. And now we're going to talk about some part of the synovial joint. So some joints themselves have a little bit more than just articular cartilage on each side, synovial fluid in the middle, right? And then the fibrous capsule surrounding the external part. Now, I'm going to show you a couple pictures later on about people with different type of joint issues. So if you take a look at this picture I have of people with rheumatoid arthritis, take a look at how big these capsules are. The thinner you become, the more prominent those capsules linking your fingers and your phalanges right here. We call this swan necking. Hopefully we don't see this anymore, right? Because we have better treatment plans than we did in the old days. But every now and then you will see elderly people with the swan necking of the fingers like that. It makes it impossible to move into each individual finger. So when they need to grab something, they need to grab it with their whole hand, right? So what do we see that are found as an accessory to the synovial joints? So we have all these components of the synovial joint. Then we have accessory structures, bursas, meniscus, tendon sheaths, and articular disc. Now the ones I want you to know is what is a bursa, what is a meniscus, what is a tendon sheath. Again, high yield stuff. Lots of things I can ask just from this one slide, right? So what do we see? What's a bursa? Pockets of synovial membrane and fluid that extends from the joint. Now I've added this, so if it's not on your original notes, make sure you write it down. They're found in areas of high friction. They act like modified thick water balloons. And it's found where we can see bone-to-bone movement or bone-to-skin movement. Here's what I mean. Right? For a bursa right here, we sometimes call it a Bursa Sac. I'm going to show you in a second a picture of the knee joint. And all the light blue, what looks like water balloons, are the bursas. So I'm going to show it to you right here. These are the bursas. These are synovial-filled sacs that are going to be found where bone can contact with other bone. Right? What happens then? Well, if it's bone on bone, let's imagine that this sac is not there. What happens is this Bursa sac's not there. Every time you move your knee joint, your patella will rub on your femur. Right? Eventually, one of these bones is going to wear away, right? As it keeps rubbing against each other. So we need this bursa to prevent the wearing away. Again, almost easier to picture what happens if it's not present. So we don't have this bursa right here, then the patella keeps rubbing on the femur every time you move. That would hurt like crazy, right? If you didn't have this bursa over here, external to the patella, what happens? Well, you can feel that there's not much external to your patella. There's just a little bit of fat and skin. That's it. So if it wasn't for this bursa right here, every time you extend your knee, anytime you flex the knee, your patella would rub on your subcutaneous tissue. It's going to keep rubbing on it and then eventually wear down your subcutaneous tissue. And it's going to wear down the dermis. And now you're going to have an ulcer that develops. So these bursas prevent friction, prevent bone on bone, and bone on skin rubbing. Now, sometimes these bursas can swell up, right? When they swell up, you get bursitis. And that's what we sometimes see with people that are, they bang their elbow. Next thing you know, there's this kind of lump full of fluid that kind of expels outwards. That's bursitis. Inflammation of the bursa causing slight leakage into the joint. Now the good news is it will repair itself. The bad news is now you have fluid in that joint, fluid in the knee, and that really restricts the movement possible. Now I watch a lot of sports, a lot of basketball, obviously, right? A lot of football as well. And what happens is a couple years ago, right, when the Miami Heat were, still like the dominant team, you always heard about Dwayne Wade with his bad knees. His knees that keep swelling up on him. especially in the finals that year. What happened was this: bone-on-bone rubbing, right? Because think about how many years he's been running and jumping at that level, right? And then eventually the bursa starts to leak. As the bursa starts to leak, it starts to leak out into the knee joint. And what they did then is just after every game, they would get a syringe and drain the bursa, right? Drain that fluid. And what happens? Well, because of the leakage, the bursa here is less enlarged now, right? It leaked out, now the bursa isn't as full. So there's greater bone-on-bone rubbing than what can be expected. And a lot of pain with his movement. That's why he wasn't very effective when he was having those knee issues. It's hard to move around with a lot of speed and force when every time you extend the leg, it hurts. Now, the other one I want you to know, meniscus. Meniscus or menisci are fibrocartilaginous pads in the knee. You have a medial and lateral menisci. They act as shock absorbers as well as deepening the joint so that it's more stable. The last one are these tendon sheaths. Tendon sheaths are found in areas where there's limited space. Do you see how much space was in the knee joint right here? There's a lot of room right here. A lot of room for all these Bursa Sacs. In certain areas of your body, there isn't that much room. Think of your wrist, your ankle joint, right? There's not a lot of room in those joints. So we don't have room for big pockets like Bursa Sacs. Instead then, we have tendon sheath. These are modified synovial or Bursa Sacs that surrounds each tendon as it goes through a bony region of your body. Again, found usually in the areas of compacted space, the wrist and the ankle. Now, it's easier to show you a picture than to kind of describe it, right? Much easier to show you that picture of the bursa right here and tell you what it does. So I'm going to show you the picture of a tendon sheath. So here are these tendon sheaths right here. You have the muscles coming down. Those muscles coming down are going to pull on the bone, right, by these tendons. So tendons are tough, thick, connective tissue, right? Dense, regular, collagenous connective tissue. Their main job is that as a muscle contracts, the tendons pull on the bone, allowing the bone to move. Think about your biceps tendon right here. So if you flex your biceps, right, you can feel the tension on the tendons. Now, the good thing about the biceps area right here, there's nothing besides the biceps. There's only one main tendon. Look at all these tendons that goes through the top of your foot. What would happen if we didn't have these tendon sheaths? Right? What happened is every time you contract the muscle, the tendons will rub against each other. The tendons will rub against the bone they're kind of stuck on. All right? Remember, look at this. They're stuck in place by all this ligament. So the more you use that muscle, the more rubbing between the tendons. And it acts like two pieces of rope. Right? As those tendons start to rub against each other, they create friction and pain. So then you would have a lot of pain with just movement of your foot and your toes. So what do we do to protect the tendons? Well, we surround synovial flattened sacs around each tendon. Right? Those flattened sacs doesn't take up as much room compared to a Bursa sac. At the same time, you still surround the tendons with that kind of protective sac, protecting it from rubbing against each other and rubbing against the bone matter that it's next to. Right? So that's the tendon sheaths. So this is your ankle. Your wrist is actually even more tight. So here's your wrist. So right away when I put down wrist tendon, tendonitis comes out, right? We'll see that in a second, what it means. So here's your wrist right here. Take a look at how small room there is, right? So this is the top of the wrist. the posterior part of the wrist, and look at all these tendon sheaths right here. Why? Because you have a lot of tendons going to all the different bones of your fingers, right? So if you move one of the bones, so if you take a look, you have your distal phalanges. In order to move the distal phalanges, you need one muscle group. In order to move the middle phalanges, you need a different muscle. To move the proximal phalanges, even a different one beyond that. So we have all these different muscles moving all these different bones in our fingers. Those muscles have to have tendons that goes through this very narrowed carpal tunnel. What happens? The more you move the fingers, the more rubbing of the tendons, the more pain you might have. So the body then enwraps and envelops those tendons with these tendon sheaths, protecting it from rubbing against each other, protecting it from rubbing against your carpal bones. Right? So keep that in mind that these sheaths are very important for that reason. Now what else do we see? Meniscus. When we talk about the knee specifically, I'll show you pictures of it. The meniscus is going to deepen the knee joint, so then it makes it really hard to actually dislocate your knee. You can dislocate it, but when you dislocate in your knee, it's a real ugly thing, right? Almost usually career-threatening thing. Right. So in terms of synovial joints will be classified based on their degree of movement. They can be uni-axial, biaxial, or multi-axial. Now keep in mind in terms of movement of the joints, right? When your arm is in anatomical position, it means that your arms are down, right? And your fingers and palms are supinated. When that happens, your radius and ulna lay side by side. So when we have this anatomical position, my arm is fully extended. Flexion is moving of that joint closer towards 90 degrees and below 90 degrees. When we talk about that movement, right, up and down like that, that goes around only one axis. That's what we call uni-axial. You think there's up and there's down, right? Well, you can move in both directions, but it's only along the same plane, the same axis point right there. Biaxial is like your shoulder joint. You can move it up, and then you can move it to the outside, right? You're moving it in two different planes. Multi-axial is also like your shoulder. You can move it up, you can move it out, and then you can spin it around completely, right? Making it multi-axial. So we're gonna see. In our book, we classify 6 different types of synovial joints. 6.